Hi everyone, I'm Dr. Namita. I am associated with Nethradhama Super Speciality Eye Hospital since the last 19 years. I'm in charge of general ophthalmology and UVEA. I take care of children and we also do cataract procedures here. Vision impairment and blindness is one of the major challenges which we face in this as a public health issue. Though a lot of progress has been happening over the last few years, it is a big burden on us. India has about 1/5 of the blindness of the world, and this is staggeringly high and disproportionately high as compared to your developing countries. We are working towards it both through the private sector and the government sector. Through private, we work it through the National Blindness Control Program. The commonest cause of blindness, what we see in our country, is cataract. It's almost responsible for 67% of the blindness, followed by uncorrected refractive errors, and these are contributing almost 19%, followed by glaucoma. The other causes of blindness include corneal injuries, trauma, childhood blindnesses, and diabetic retinopathy. The whole irony in this is that 92.7% of these blindnesses are preventable, and 97% of visual impairment is also preventable. So the question is, what is happening? Why are we not able to take care of this burden of blindness? We have a lot of problems in giving care to the people in our country. The most important is the population, and 70% of our population lives in the rural areas. And the biggest barrier what we find for accessing healthcare facilities is lack of awareness. Most of the people are uneducated. They are not aware about the healthcare facilities. The second important thing is the rural areas do not have that many healthcare facilities, and they do not have an access to technologies. Currently, we still have a lot to go ahead, and COVID pandemic has made us go back by a few years because a lot of hospitals were closed during COVID, and this led to the burden of blindness to continue. But all is not so bleak. Again, the programs have been started, and private sector has taken a very important leap into this, wherein we are taking care of all these preventable blindness. We are doing school screening camps to catch hold of the uncorrected refractive errors. We are going to rural areas to take care of cataracts, and the National Blindness Control Program is a part of this association with all the private sectors. At Nethradhama, we are relentlessly working towards reducing the global burden of blindness. We are breaking the barriers and seeing that the rural areas have access to eye care technologies and all the newer technologies which we can do to reduce the burden of blindness. The challenges are many. We have started eye screening camps, we do rural camps, we go right into the place where the eye care is required and get these patients to our centers and take care and operate them and send them back. The challenges here are large, but we plan to have a brighter future and give our contribution to reduce the burden of preventable blindness.